One question I'm asked a lot by clients or when I do talks is the question about acid alkaline balance. And it's particularly important for cancer patients because there are quite a lot of myths floating around the internet and also among health practitioners that we can prevent or even cure cancer with an alkaline diet. So I want to show you the evidence for or against this and whether it's worth going on an alkaline diet. And what I also would like to address is osteoporosis, because again, that's one of the things you hear a lot if you have an acidic diet, that in order to neutralize this acidity, we need to pull minerals out of the bones, and that can lead to osteopenia or osteoporosis. And the other thing then that we're going to look at is with a particular focus on the ketogenic diet, because that's one of the concerns that a lot of people have, because there are the terms acidosis and ketoacidosis in the back of their heads. And so is a ketogenic diet making us acidic basically as well? So I hope you enjoy this presentation and learn lots. Okay, let's start with having a quick look at what pH actually is. Experts aren't quite sure what pH stands for, but it's probably or most likely power of hydrogen. The term pH gives us an indication about hydrogen ion concentration in a solution. So, for example, what proportion of a solution contains hydrogen ions? The pH scale goes from 1 to 14. And a pH of 7 is neutral, which means that the amount of hydrogen ions and hydroxide ions in a solution are equal. For example, water has a pH of 7 because when water breaks up, the split is equitable into 1 hydrogen ion for every hydroxide ion. If there are more hydrogen ions than hydroxide ions in a solution, it is acidic and pH is below 7. On the other hand, if a solution contains more hydroxide ions than hydrogen ions, it is basic and its pH is higher than 7. So foods leave an acid or alkaline ash behind. What type of ash this is depends on acid-forming components, so for instance phosphate and sulfur, or alkalis, so for instance calcium, magnesium and potassium. Very generally speaking, animal products and grains are acid forming, whereas fruits and vegetables are alkali forming. Pure fats, sugars, and starches, however, are neutral because they neither contain protein, sulfur, or minerals. Foods we eat have the power to change the pH of our urine, and it's very easy to measure this. It might be one of the reasons why so-called alkalizing diets have become so popular, because people can see what impact their food choices have on their urine pH, and it's really easy to measure it. But is urine pH really a good indicator of overall pH in the body and blood especially, and more importantly of overall health? So how does food influence blood pH? It is a myth that we can change the pH of our blood by changing the foods we eat, or that acidic blood causes disease while alkaline blood keeps us healthy. The body very tightly regulates the pH of our blood and extracellular fluid at 7.35 to 7.45. So it's a very tight range that the pH in the blood is in. So that's regardless of what we eat or what our urine pH is. There are a few exceptions. Sodium bicarbonate can temporarily increase blood pH, but often also causes bloating and other GI discomfort. And as we already saw, a state of acidosis, so acid overload in the body, can happen when, for instance, ketone bodies rise too quickly and too high, but it can also be caused by chronic renal insufficiency, for instance. The kidneys are the ultimate regulator of blood pH in a sustainable cycle. When we digest, for instance, protein, the acids that are produced are quickly buffered or neutralized by bicarbonate ions from the blood. This reaction leads to the production of carbon dioxide, and that's exhaled through the lungs, and also salts, which are excreted by the kidneys. During the process of getting rid of these salts, the kidney produce new bicarbonate ions that then replace the bicarbonate that was initially used to buffer the acid. So you see, this is a very sustainable cycle and it's a very efficient cycle. So claims have been made with regards to bone health as well and alkaline diets. The theory of proponents is that blood pH is kept in a tight range by pulling minerals from bones to neutralize any excess acid from the diet. This acid ash hypothesis of osteoporosis has been debunked by both clinical trials and also observational studies. So there's one example from Bonjour in the British Journal of Nutrition in 2013. As we've seen above, the kidneys are perfectly capable of dealing with the acid ash from food without any involvement of the bones. So let's move on then to cancer and the connection to pH. As we've seen, our food choices can substantially change the pH of the blood and extracellular fluids. It just would be downright dangerous. The claim that alkaline diets can cure cancer is nothing more than that, a claim without any scientific basis. Cancer cells have also shown to be perfectly capable of originating in a slightly alkaline environment of 7.4, which is the pH of normal body tissue and obviously also the blood. So there are papers that confirm that, and in a lot of trials actually that's what is being used to grow cancer cells in a petri dish, for instance. Often you also hear that cancer cells grow and metastasize better in an acidic environment, which is true. But we know that cancer cells use fermentation to generate energy, and we see that on the right here, the process of glycolysis. And this process creates a byproduct called lactic acid. And of course, as the name says it is acidic. So hence the causality is reverse. It's not an acidic environment that causes cancer, it's the cancer that causes the acidic environment. And also, I quote Dominic D'Agostino, one of the best researchers at the moment in ketogenic diets, and especially with a focus on cancer as well. He stated that an alkaline diet can't hurt, but it won't do much to restore defective cancer cell metabolism or even change the tumor microenvironment. And that's what we're trying to achieve with a ketogenic diet, obviously, restoring defective cancer cell metabolism or making sure the preferred fuel, glucose, isn't available. So what is the story then? Because a lot of people, they don't consume masses of alkalizing foods on the ketogenic diet because carbohydrate intake is very limited for some people. So is this a problem? One paper that I found, and I'm sure there's more out there, and we have seen that the acidity of foods can't influence the pH of the blood. But it's a clear statement here in this particular paper by Maninen that in ketosis, the blood pH remains buffered within normal limits. And that was published in a paper called Metabolic Effects of the Very Low Carbohydrate Diets, Misunderstood Villains of Human Metabolism. So there is absolutely no doubt that phytochemicals in plants are beneficial for cancer patients and also anybody who wants to protect themselves. But as I said, adding a lot of alkaline foods to the diet, it means adding more fruit and vegetables, which increases carbohydrate content in the diet. So my advice is to include green leafy vegetables and other non-starchy vegetables as much as you can within your carbohydrate allowance. And there are lots of tips and tricks how you can also make sure you get a lot more out by combining certain foods. And that's what I'm looking at then in the next module as well. I hope this presentation gave you a good insight into the evidence for alkaline diets and whether you have to worry about acid and alkaline foods. So if you like this video, I invite you to go over to www.ketoforyou.com, and you can there then sign up for a 3-part series and get a taste of my keto course.